And our last presenters of the day.
So my name is Kaitlyn Nott.
And I'm Shivani.
We were working with Dr. Jamie Penner this summer on dementia-friendly communities and family caregivers. So we started with Jamie in May, and throughout that process we did a lot of training institutes through the MCNHR, which we found very valuable to our learning because both of us don't have a primary involvement in research. So like I said, we did family caregiving and dementia-friendly communities. So I don't know if many of you know, but family caregivers are essential in their roles, especially with people with dementia. They care for people in the community. They allow people to stay in their homes within the community. They do anything from cooking to cleaning to transport. Without them, I don't know where they would be. And dementia-friendly communities are an emerging approach in Canada. They have been studied elsewhere in Japan and the UK and been quite developed over there. And these communities focus on inclusion and support of those with dementia as well as their caregivers. So things like a static space is an inclusion of dementia-friendly communities, as well as things such as programs for family members as well as caregivers, and those with dementia, such as coffee shops, choirs, etc. So we wanted to understand caregivers' experiences of dementia-friendly community, so we set out on a scoping review this summer.
So as I mentioned, I'm Shivani, but I'm not from this faculty. I'm from the Department of Psychology, and I just wanted, because I have, let me restart this. I'm an aspiring graduate student, and I wanted to have some research experience, which is why I wanted to go outside of my faculty to get more interdisciplinary experience, and it paid out. So we're working on a scoping review, and a brief explanation of what a scoping review is that it provides us an overview on a broad topic, ours being dementia-friendly communities. We wouldn't say that dementia-friendly communities is new, but it has been definitely an understudied topic, as Kaitlyn had mentioned. And a scoping review also informs us the extent and the nature of the subject area that we're looking at, but it also helps reveal the gaps in the knowledge, and here being on family caregivers within dementia-friendly communities, and that helps us to inform our future work. Some of the research questions we worked on, there's 3 of them. So we looked at the ways in which family caregivers are included and supported within DFCs. We also looked at their perceptions and what the impact of dementia-friendly communities have on the family caregivers. With the overall objective being that we really wanted to explore the experience of family caregivers, of those living with dementia within the DFCs. So this summer research experience has allowed us to get a lot of technical skills. I have to say, Sochi, I do not relate with you on the EndNote experience. I had a very different experience with EndNote. But we started with developing our research questions, and basically they're the stepping stones to helping you form your later search strategies. Then we moved on to conducting lit searches. We used a lot of databases, so Sinol, Scopus, just to name 2 of the many out there. Data management, and Nott. We had a total of 1,311 articles that we retrieved, and that both Kaitlyn and I screened. We screened for title, abstract, and full text, and we assessed the articles against the inclusion and exclusion criteria. We then went on to the next step, which is data extraction. We used a spreadsheet, Excel, to extract the relevant information pertaining to our research questions. And then we went on to, we're working currently on synthesizing the evidence, and the last step being knowledge dissemination, where we plan to synthesize all the knowledge that we've had from the scoping reviews and the articles overall, and plan to write up our results in a peer-reviewed journal.
So what we've learned for myself, scoping reviews were a new topic to me, introduced in a course in the College of Nursing, but Jamie's really developed our knowledge on those and kind of guided us in how to conduct the scoping review, which is more than just a literature search and going through the literature. It involves expanding your scope and looking at different places where you wouldn't normally look for research, so using different databases and other great literature, as well as kind of points to future research direction. So myself being a College of Nursing student, family caregiving is something that I was very interested in going forward, and so meeting with Jamie Penner really found that it kind of matched up, and going forward, seeing just how necessary they are within the community, and kind of learning where those research gaps are as a point for future work. And that research plans are just outlines. Like Shivani said, we did have a lot of problems with EndNote this summer. It was not a smooth transition to the program, but just being flexible with what you were doing with working and knowing that it may take you a lot longer to get something done that you thought was going to take you an hour.
So my summer research experience has been really insightful. It's allowed me to hone a lot of skills, not only as a student researcher, but also through different channels, from being mentored by Professor Jamie Penner to the different resources on campus. So the Summer Research Institute being one of them, and also the really good supportive assistance we had from the librarians. We came up with many questions for you, but you helped guide us, so thank you. The summer research experience has also allowed me to develop critical skills, critical thinking, but also how to introduce us and further our knowledge on methodologies, with scoping reviews being just one of the many out there. And it's inspired me to continue looking for a similar experience that allowed for learning, creativity, autonomy, all while being part of a team. On a personal level, I wanted to have an atmosphere of what research entails. My major is psychology, so I'm really grateful to, I almost feel like I'm a spy in this faculty because I'm not a nursing student. So I'm really grateful to have had the opportunity of learning research and to use it to broaden my vision, but with an interdisciplinary lens. So in terms of this study, I think in particular it was looking at dementia patients, so that would fall within the scope of abnormal psychology. So it was really interesting to see and work on a research project where it is about something that's out there in the community and not just theoretically in books. And also, I would definitely recommend other summer student experiences, if you're watching, to definitely look for research experience, because it helps you deepen your knowledge and involvement with your subject of study, but also it's a great opportunity to get just an avant-goût of what research is if you're looking to get more experience for your master's later on.
So lastly, we just like to thank Jamie Penner especially. She's been great helping us in the transition of learning research and understanding what this whole process is about, as well as the MCN HR for housing us, even though we were not good tenants and we were not there often, but we do thank you for your space and offering your assistance to us, and then the librarians who kind of helped us parse out all of the minor details that we needed to work through. Thank you.